Burnback is a problem that we commonly encounter with laser lithotripsy. Essentially, burnback is degradation of the tip of the fiber as you're fragmenting the stone. It's more common with harder stone compositions such as calcium oxalate monohydrate, and it's more common with higher energy settings. At Duke, we've actually done a study looking at this and shown that at energy settings of 0.2 joules and even 0.6 joules, you get minimal to no burnback. At 0.8 joules, you start to see some burnback. At 1 joule, you have a significantly higher rate of burnback as compared to the lower energy settings. And the reason burnback is significant is because during the case, eventually the tip can degrade to the point where you can't use it. Then you have to remove the fiber, strip the fiber tip, and proceed with the case. And this takes time. And oftentimes you find yourself with a flexible ureteroscope in particular in a very nice position to fragment the stone, and you have to stop what you're doing, which can be really frustrating and impact your ability to complete the case. Yeah, the stone dusting technique can speed up the procedure in certain instances. For instance, in a ureteral stone, if you're able to fragment the stone into very, very small pieces, you don't have to worry about then pulling the fragments in and out. And that's definitely an instance where I think dusting helps speed up the case. In the kidney, it's a little bit more debatable. I feel like it's my preference to do stone dusting. There are people who like to basket. I find that it's quicker in my hands, particularly in soft stone types. And I think it's also less risky. There's less risk involved. You're not concerned about pulling fragments out where they may get stuck in the ureter as you go in and out of the ureter. Dusting can help you get to the basket stage faster in certain cases. I think it really depends on your approach to those types of stones. In a soft stone, there's no doubt, because the soft stones, you'll often just see them melt away, and then eventually as they get small enough, it becomes more difficult to target them. And certainly a lot of people will dust a stone until it's small enough that they are not comfortable in the kidney in particular, targeting it with the laser and then basket it out. So the holmium laser, in terms of collateral tissue damage, the holmium laser has been shown to be very safe. It's a contact laser, meaning it exerts its effect in contact with whatever it's treating. The depth of penetration for a holmium laser, the energy depth is less than 1 millimeter. So even in direct contact with the mucosa of the kidney, you're only damaging the surface. It's obviously very important to avoid contacting the mucosa, but even on the times when you do, really the collateral damage is fairly minimal unless you're negligent. At lower energy settings, there probably is less collateral damage, but truthfully, just being cautious and being careful and making sure you don't leave the laser in contact with the tissue. If it touches it intermittently, you're not going to cause a huge amount of damage. Can you perform the dusting technique with a 20-watt laser? The limitations of a 20-watt laser are really primarily the hertz. So you could do low energy, but it'll be at low frequency and it'll be a much slower process. I think the advantage of using a high-powered or 100-watt laser is you're able to deliver the amount of energy you want. So for us, it's 10 watts, 0.2 joules, 50 hertz, which aids in making the dusting a lot quicker. In the ureter, I think, is where 0.2 joules and 50 hertz has the added advantage, where you see less retropulsion because there's less energy delivered per shot on the stone. And the stone tends to stay in place more as you fragment it. But I think the benefit comes in is it gives you a lot of flexibility. And what I've experienced since being able to use a 100-watt laser is I'll experiment and play with my settings in different scenarios, and it allows you to find what works for you.